Welcome back to our program, and I'm your host, Wu Ruiguo. In this final segment of today's program, we will continue our conversation with the Honorable葉金川, Minister of Health of the Republic of China. Minister, we understand that WHO breakthrough this year is very, very important. But I think most of the people in Taiwan would like to see our international space further expanded, maybe onto other UN-affiliated organizations or other NGOs. For example, we often talk about the World Bank, OECD, IMF, and you have been to this year's WHA. And can you draw from that experience and share with us your views about Taiwan expanding our international space?
Yeah, I'm the expert in health affairs, but not in other aspects of UN activity.
Yes.
But I think environmental protection will be another important
area.
one.
Yes.
It is. Taiwan is part of the global community
exactly.
in this field, and it's important, I think, to participate in. They have many programs, UNEP, Environmental Protection, UN, FCCT or something like that's CO2 containment or something. But from the health aspect, we have other activity or other international organization we can participate. For example, OECD.
Yes.
OECD have, because WHO have 191 members.
Yes.
And very variety of countries. Some about 100 countries, they don't have enough healthcare system. They don't have vaccine. They don't have medicine. They need help. And in Taiwan, we should join OECD. That's another aspect.
Yes.
And they're talking about health quality and health. That's what we need because we are in this group.
Yes.
It's like this is major league, this is minor league.
Yes.
Maybe we should try to join some parts of the activity of OECD, especially in public health field.
Okay.
And our experience, we are one of the leading country in this healthcare system.
Yes.
Actually, you may notice that US, they are looking at the Taiwan system, Japan, Germany, British. Taiwan is one of the systems. They are follow the steps.
Yes.
But they have their strengths. I mean, OECD, they are much better in research and development, education, medical education. That's our weak part. We can share with those developed countries.
Yes.
We are maybe now one of the developed countries.
Yes.
We should have the ability to join this so-called OECD community.
Community of developed nations.
Developed nations.
Yes, exactly. And also, Minister, we understand that we talked earlier about the world today is a global village. And we're all internationally connected. And a lot of times we need to resolve health-related issues, not by a single country only, but by multilateral, by a number of countries joining in together. And you have mentioned earlier that during your trip to the World Health Assembly this year, you met your counterparts from the United States, from Japan, from EU countries, as well as from China. And would you think that in the future, God forbid that there should be another, a serious pandemic. But if there is a crisis situation, that today, Taiwan's public health, capabilities are much improved because of the possibility of have regional or international cooperation with other countries.
Regional first.
First, okay.
For example, dengue fever, we have dengue.
Yes.
Every year we have about 200 cases imported from Southeast Asia.
Yes.
But you know how many cases in Southeast Asia? They have a bunch.
Yes.
They have so many thousands.
Yes.
So it would be a good issue to talk to Singapore or Malaysia or
Indonesia
yes. to have those dengue control like dengue. It's possible to have vaccine. Something like that.
Good.
I just talked about I mentioned earlier EV71. It's a kind of enterovirus, just like poliomyelitis, something like. But it happened. It's epidemic in Japan, Korea, Taiwan, China, Hong Kong.
Yes.
And we should have a
effort,
consortium or
yes.
a joint effort to deal with those common diseases.
Yes.
Taiwan alone, it's not easy to develop this vaccine, but with this consortium or something,
yes.
arrangement, we can deal with this problem
together.
Okay, then look at the global international cooperation.
Yes.
We can find out some issue that is common to the world community, and Taiwan is one of the leading country can contribute to this. For example, anti-smoking. We are the developing country, but we do the best.
Yes.
It's not. For example, China, they cannot copy Sweden or Denmark, how they control the anti-smoking problem. But Taiwan is, in 20 years ago, we were just like China today.
Yeah.
So they can follow our steps, how we can do this job, make this thing happen. And we can find out some issue like this, we can demonstrate our experience.
Exactly.
Even in poor country, third world country,
yes.
You may notice that 40 years ago, 50 years ago, Taiwan is the same as their status, and how we step by step from a poor country to a developing country and
to a developed country. Yes.
In many fields, not only public health,
yes.
in economy, in education, in public health.
Yes, science and technology.
Science and technology.
Yeah, exactly.
Yes.
And we understand that, Minister, in addition to what we mentioned with the coming of the fall season, the winter season, we may see another outbreak of the influenza A. But other than that, what do you think are some of the major challenges confronting Taiwan's public health concerns today? Education?
Actually, it's the aging problem.
Okay. Yes.
I think that's
aging population.
Yes. Aging population. That's the most important thing. It's a
Mm-hmm.
chronic condition, but
yes.
we should stop. We should have a solution now.
Yes.
Because in my age,
You're
I'm
still very young.
No. I'm 1950.
Yeah.
In my same age, we have about 400,000
people.
40万嘛.
Oh yes. Yes.
But today,
yes.
2008,
yes.
we have only 196,000.
196.
Yeah, just half of my age.
Yes.
And that means one children today had to raise two age people like me.
Yes.
That's a serious problem.
Okay.
Okay, and because of that, we have long-term care program.
Yes.
We have pension program. We have health insurance program. But those programs are depend on our young people
contributing into the system.
If we cannot change this age structure, then those systems will bankrupt. Health insurance, long-term care insurance, and the pension program. So it's time to
really look at this aging, serious, this problem. Yes. Finally, Minister, we understand that throughout your career, you have been a professor, educator, school administrator, university administrator, and also, of course, a very high-ranking government official, both at the local and now at the central level. Which role do you like the best?
Teaching, professor.
You like to be a professor.
Yeah.
But how about your experience in serving the public?
Actually, it's not my own choice.
Yes.
To educate people, at my age, I think we need to have more young people, young students
Yes.
who are dedicated. They are, wish to devote it to public health, to public administration,
Service, yes.
to serve the people.
Yeah. What would be your word of recommendation, word of advice to them?
To the young people.
Young people to join the government, to join public, service.
It's not a good job to
It's very demanding, I would imagine. Yes.
But if we wish to do something,
make a difference.
Make a difference. That's a choice.
Okay.
The only choice.
Yes.
Although it's demanding.
Yes. Well, thank you very much, Minister, for agreeing to be on our program. We certainly wish you all the best in all your future endeavors, and also in the future, when the opportunity is right and you have the time available, we'll be very much delighted and honored to have you back again as a guest. Thank you very much, Minister.
My pleasure. Thank you.
Thank you for watching our program. I'll see you next time on MacroView Television. Thank you.